So she says that health then is providing care to our patients that matches their cultural beliefs and values and is able to impact them in a way that is culturally sensitive and takes into account their cultural ideas and functions in society. So if we don't look at culture of a patient, then we cannot provide health for people. And people are healthy when they are culturally, correct, I guess. When they are following their culture to the best way possible for them, then they are healthy. So if I believe that I should pray every night and I'm not praying every night, then I would be unhealthy because my culture says I must pray and I'm not doing that, so then I would be unhealthy, right? If I believe in a specific traditional practice and I am not engaging in that, then I would be considered unhealthy, right? Whatever is important in your culture. So physiologically, through our body and our own wellness, but mentally and spiritually as well. So looking at all the areas of health. And she says that we need to make sure our environment is culturally congruent so that our culture is appropriate for patients. So we have like a very specific way that we provide nursing care, right? Patients come into a hospital, which is a big building that is designed in a specific way to meet our needs as healthcare professionals, right? They go to the ward or to the unit, and on the ward or the unit, they have their individual beds, or they have rooms of 2 or 4 or 6 or 8 or 16 patients, depending on the hospital and the size and the environment, right? And they have a very specific types of hospital beds with specific equipment, and things are set up in an infection control way, right? With, tile floors or wood floors or floors like this, laminate, right? That can be easily cleaned, curtains that can be removed for easy cleaning, and a very specific formula that we design hospitals for, right? And whether you go to a hospital in Canada or in Qatar or in different countries around the world, the same principles are generally there, right? We try to engage in infection control, and we have like lots of good reasons for doing these things and setting up hospitals this way. They're set up for infection control purposes and to better enhance the care that we're providing to patients from an evidence-based standpoint, right? What they don't do is consider the culture of the people, right? So if you walk into HMC, except for the mosque in the middle of the hospital, HMC could be anywhere in the world, right? Is there anything that makes it Qatari? Not really, right? It looks like a hospital. If I walk into a hospital in Canada, it's a hospital. If I walk into a hospital, I've walked into hospitals in the UK, they look the same. They're hospitals. I've walked into hospitals in Poland and in Thailand, they're the same hospitals. The US, the same hospitals. I've not been everywhere in hospitals, but I've been in hospitals in those countries, and they all are the same, right? The same format. Are they culturally sensitive? No, right? They're culturally sensitive to my needs as a nurse because I can walk in and know what I'm supposed to do, but they're not actually necessarily meeting the cultural needs of patients, right? Maybe they're not warm or inviting. There's no magilist in the hospital here. There's no area maybe for specific religious practices or for families or for other people to take care of things that they need, or pantries for people to cook. You know, when I lived in Thailand, hospital food was not provided in the hospital, right? You had to bring food from outside for your loved ones who were staying in the hospital. You couldn't buy food in the hospital, and there was no nutrition services to bring food to patients. Family members must bring food or your patient does not eat. So there's no cooking facilities in the hospital. So if you're poor or you don't have the ability or no family members to come to serve you, you will have no food in the hospital. There's no cooking facilities in the hospital for people to make their own food or to, have access to food. This is not very culturally sensitive, right? If we know that there is no food in no facilities in the hospital to make food and nobody to bring you food, then you're going to starve, right? This is the problem, right? So we need to consider culturally sensitive care when we're providing care to our patients, from the environment to the way that we actually enact our nursing care. And that's what Leininger is talking about trying to provide care that is as culturally congruent as possible.